Thank you. Oh, here. I hope you can understand me also in the back of the room. Is that okay? It's a pleasure and an honor for me to join our dialogue today and our discussion with each other. And we thought it might be helpful for you to have a short introduction about our work. So I'll start off with that and tell you a bit about the center that Rogier already told you about, the Center for Mindfulness that is based in our University Medical Hospital, Radboud Hospital in Nijmegen. So it's about the same duration, I would think, 10, 12 years that we sort of have been working in that center together with my colleagues, and we offer mindfulness-based courses, the traditional 8-week course. I will tell you a bit about that if you haven't heard about that as yet. To patients with psychiatric disorders. Being a psychiatrist, that is my sort of profession. But we also offer these courses to patients with chronic somatic conditions like cancer or multiple sclerosis or Parkinson's disease, people who are confronted with severe and sometimes terminal diseases that they have to cope with. And we offer courses to employees of both the university and the hospital, to medical students, medical doctors in training, general practitioners, medical consultants, because we believe it might support them in their work, might prevent them from getting burnout or diminish burnout symptoms, and support their mental health and also the contact they have with their patients. We do a lot of clinical research because we are part of a university hospital. That's what we're supposed to be doing, and we think it's important to be doing mostly clinical research, also some fundamental research in terms of how exactly do mindfulness-based approaches work. Can we understand a bit more about the mechanisms behind that? And we offer a teacher training course for people from all kinds of fields, really. Healthcare, of course, but also education, primary education, secondary education, people working in prisons, people working for organizations, and other backgrounds. So what is mindfulness? Well, for what it's worth, I will provide you with the definition of John Kabat-Zinn. John Kabat-Zinn is the founder of the application of mindfulness-based approaches in healthcare. He came up with the idea of actually teaching an 8-week course to patients in a hospital and teaching them the skills to be more mindful, be more attentive, take better care of themselves. And his definition of mindfulness he provided us with already a few years ago is paying attention to the present moment, the here and now, and do it with an open, curious, friendly, kind mind, without having an opinion immediately or without having to react to your experience. And the popularity of mindfulness in healthcare has actually started off with the introduction of mindfulness-based cognitive therapy, because the people who combined the mindfulness approach with some elements of the cognitive therapy started with doing proper scientific research. So they started with multi-center randomized controlled trials, which is the gold standard of clinical research, and that actually introduced mindfulness into healthcare and also gained the attention of physicians and scientists for this particular approach. And it usually consists of an 8-week course, also including a full day of practice towards the end. Groups are among 8 to 12 participants, sessions are 2.5 hours, and people are asked to practice on a daily basis with the meditation exercises. So it requires quite a bit from participants to these courses, particularly in a setting that they're often not acquainted with these meditative traditions at all. So what kind of exercises are part of those courses? Partly it's formal meditation practices, sitting meditation, yoga, mindful movement, mindful walking, that are part of the courses. It's also informal meditation, so we encourage people to pay attention to their daily routine activities, like cycling to work or washing up, or reading to their children, or talking to their colleagues. And very short meditative exercises like the 3-minute breathing space are part of that. And some of the more classical cognitive therapeutic techniques. And what do participants learn from those courses? Well, first of all, they learn to stop, to stand still, which is not a self-evident thing in our modern society. We usually sort of live our lives on an automatic pilot and are defined often by what other people expect of us or what's in our diary, and before we know it, it's the weekend again, and that has been planned full with social activities as well. So stopping yourself, noticing where your attention is, learning to pay attention to one focus, the breathing, for instance, being open to the current experience, noticing bodily sensations that might take place, thoughts, emotions, learning about the relationship between these phenomena, and recognizing your own automatic patterns, your own behavioral automatic patterns in terms of your attachments to particular things that you strive for in life, or the things that you would like to run away from, or rather have them disappear. And considering and experimenting with relating to these experiences in a different way. So letting go of particular patterns and allowing things that are difficult, like sadness or anxiety, losses, illness, death. So people learn to take better care of themselves, and they learn to be more compassionate towards themselves and also towards others. So this is the first study that actually started off the popularity of mindfulness-based interventions in healthcare, a study by Teasdale and his colleagues showing that MBCT resulted in a substantial reduction of the risk of a relapse in depression in people with a very high risk of that. And that particular study has been replicated now for several times, and this is a recent meta-analysis in which all the results of these studies are combined, actually sort of confirming the findings of the first study, namely a substantial reduction in risk of relapse in depression. But mindfulness-based interventions have been applied across a lot of different conditions and in people with a lot of different symptoms as well. So this is a meta-analysis again, but getting together studies in different areas, mental disorders, but also people with chronic pain, cancer, showing that mindfulness is helpful in reducing symptoms of anxiety and depression across all these different populations. And when we look at effectiveness, we also are interested to know, is that effect actually caused, or does mindfulness help in resulting in those effects? And what we see in studies is that indeed mindfulness skills, like being able to observe your own emotions, being less judgmental about them, less reactive about them, is one of the mechanisms in which these effects take place. And another finding about that is that one of the phenomena that contributes to psychological symptoms like anxiety and depression is rumination or repetitive thinking, worrying, and mindfulness also helps to reduce that. And that is one of the other mechanisms that we think mindfulness might work. It reduces rumination and repetitive negative thinking. There's quite some brain research now supporting the effectiveness of mindfulness. This is a meta-analysis of structural brain scans. That means that people are looking at the structure of our brains, looking at the grey and the white matter which our brains consist of. And they're actually able to show us that people who meditate, and even people who are meditating for as long as 8 weeks, that particular areas in the brain develop more fully. Areas connected to emotion regulation, or memory, or somatosensory, being able to the somatosensory awareness, meta-awareness. So also cognitive processes that are meaningfully linked to mindfulness. And not only structural brain scans, but also functional brain scans looking at activation of particular networks in the brain. And studies have been looking at focused attention, one of the elements of the mindfulness training, but also at open monitoring attention, so being aware of the experience as it presents itself in all its aspects, and also at loving kindness and compassion meditation, all associated with slightly different areas in the brain. So I would like to show you a bit of our own work in this area. I've brought a few slides of projects and research studies that we have been conducting in our own center, and some of our colleagues are present who have been conducting these. One of the first was a study where we showed that mindfulness not only helps in reducing the risk of relapse in depression, but also helps to reduce depressive symptoms itself. Another study of Marloes Huibers, who's at the back of the room, was on whether mindfulness could help protect people who would like to withdraw from their antidepressant medication. And as I discussed just before this meeting, research does not always yield the results you would expect or you would hope for. And this particular study, we actually found that mindfulness did not protect people against relapse who withdraw from their medication. So it wasn't as simple as we had thought at the time. We did find, however, and that is a study conducted by Lotte, who's sitting here in front of the room, that mindfulness helps to reduce symptoms of ADHD, of hyperactivity and attention deficit in adults with these problems, and that is also a cost-effective intervention. Cost effectiveness is one of the aspects of medical interventions that insurance companies and the government are looking at much more closely nowadays than in the past, and quite rightfully so. So we are also looking at these kind of aspects of mindfulness-based interventions to make them more accessible to people. This is a study of mindfulness-based interventions in patients with lung cancer and their partners, in which we were able to show that it helps them in reducing symptoms of depression and anxiety, which many of these patients develop in the face of this severe and often terminal illness. Another study looking at the online delivery of mindfulness-based interventions. That's another sort of format that we're looking at, particularly for people with physical limitations who can't easily come to our center every week and attend 2.5-hour sessions like people with cancer, and to see if we offer it online with a therapist, connecting with them every week to see how they are doing, whether that might be a way to offer mindfulness to them. And actually, from the results of this study, it appeared that the online delivery of mindfulness is as effective, or is also much more effective than treatment as usual, similarly to the face-to-face classical group format. Then a study on mindfulness for medical students at the start of their internship, their kooschappen, if you understand that better. And we followed these students up for about 2 years, so quite a long follow-up period. And over the course of that follow-up period, we were able to show that mindfulness not only reduced their psychological symptoms, but also increased or improved their mental health, so their flexibility, their adaptability, their social context, their feeling that their life had a meaning and that they could contribute to society in a meaningful way. Those kind of dimensions are part of that measure. We did a study in medical residents, medical and surgical residents, so those are doctors that are training to become medical specialists further on in their training, and these were people from surgery, from dermatology, gynecology, all kinds of specialties taking part. And we were also able, in this particular population, to show that especially those residents with burnout symptoms, which was a subset of them. Mindfulness was very helpful in reducing those burnout symptoms. And to end off with some quotes of a more qualitative study, so we don't only do quantitative research, so looking at numbers and amounts and extents of particular dimensions, but also interview studies in which we talk to people about their experience with the course and what they learned from it. And this was a particular, this study was in GPs, and we asked them what they had taken away from the mindfulness course they had participated in. And I brought two quotes that are quite illustrative about what they learned from it. And one of the GPs said, I think mindfulness deals with, and these are big words, a sort of unconditional right of existence that all human beings have. For me, this means that I don't need to prove myself, that I can simply be the way I am. So these are the kinds of experience that people take away from the course. And another one said, this stone, it was a sort of symbol that we asked people at the end of the course to bring to remind themselves of what they learned from the course. And he said, this stone lies on the desk in my office. I use it when I'm stuck with a patient. I will have a look at the stone, breathe, and try to feel some love for him or her. It gives me more space, and I can continue without being annoyed with my patient. And this is our last slide. We are organizing an international conference on mindfulness in July in Amsterdam this year. So people who are really interested to hear more about that should keep an eye out and visit that, because a lot of people working in these fields will come to the Netherlands to share their work.
Thank you very much, Anna. I think we have time for one or two questions. Anyone who likes to ask something or add something? Or is it crystal clear? Yeah, maybe?
I wondered the importance, I don't know if maybe, the importance of groups. Is there an importance to do this in groups? Or because the online is also effective?
Yeah, that's a very interesting question. The question is what's the importance of the group context of the mindfulness courses? And we are doing some research on that, which we don't have the results from as yet, but we did do some qualitative research around that, particularly in patients with cancer, but also a bit about in patients with depression. And it's got two sides, really, the group context. In patients with cancer, one side is that people sometimes don't look forward to meeting other people with problems, as they are struggling with their own problem already. So ze zien er tegenop, so they don't relish to the prospect of doing so. The other side is that if they take that hurdle and don't leave prematurely because of it, they learn to see that actually their suffering is very similar to the suffering of other beings, and they feel part of that. And they also can see the human being behind the illness, and then it's actually very helpful to them. So those are two aspects of the group training. How people experience the more individual approach in the online is that they miss out on the group aspects, of course, but advantage of that is the online training is that they can practice and read and do things at their own pace. They can do it one piece at a time in their own setting. And also the therapists delivering the online training say people can't get away with not practicing so easily, so they practice a lot more because they have to show and report on that. So on one hand it's more intensive, And also because the feedback is very tailored to their own experience, it sometimes can be deeper or more reach a level that you don't reach in the group context. So each approach got its advantage and disadvantage, really.
Another question? I think you're saving everything for the dialogue for later. Please.
Oh yeah, I have a question. Did you also experience that mindfulness can counteract, can counteract, for example, when people who are like ill, if they make a body scan and they do like experience these bodily sensations even more?
Yeah.
Like, yeah.
So can it be counterproductive, or can mindfulness result in adverse effects for some people?
Yeah.
Yes, sure. And that's actually sort of an area of interest that is gaining more attention recently. So partly mindfulness invites people to stay with their experience, and experiences are not always pleasant. So experiencing things as being uncomfortable or painful or whatever is part of the learning process, so to speak. So even if people have lung cancer and they focus on their body, they come across areas in their body that are uncomfortable or that they feel tight or short of breath or feel anxiety or fear. And that's actually exactly what you would like people to help with experiencing and being with and exploring their thoughts and their emotions and what they feel like doing and experimenting with avoiding it and what the effect of that is and allowing it and what the effect of that is. And so part of it is part of the learning process. But it might also be that there are adverse effects that are really sort of not intended and that might be quite severe. And one particular researcher, Britain Willoughby, has published an important study about that, which made us aware that we should probably more structurally and systematically assess possible adverse effects in our participants. So for future studies we will try and do that to get a better idea of how many people suffer from side effects or adverse effects that you wouldn't like them to suffer from.
Just to add something small to that, in psychiatry I noticed that patients with psychosis and dissociation, so a very severe trauma at a very early age, these two are most vulnerable, it seems, to specific forms of meditation. Mostly the more mental forms and less the more bodily based forms. Maybe you get to that later. One more last?
Yes, I will.
Martin.
Yes, you had a talk about 90% about research and about a little talk about the methods, when I can talk, say it like that, from mindfulness. Do you think there is much difference in the method in different places where mindfulness is done? Is there some ways that you do it in Holland and you do it at different places? Or then you talk about the method of mindfulness. It was not difficult, it was easy to understand. So that's my question, is there difference in the methods?
Well, most of my talk was about research because I represent the outer science. And one of the aspects of the outer science is that we like interventions to be protocolized, standardized, because if everyone is doing something different, then you can measure what the outcome is, but you don't know the outcome of what, because everyone is doing his own thing. So on one hand, mindfulness-based interventions are pretty standard across the world, and that is one of the reasons that it's been quite successful in getting attention and getting research attention and getting implemented. So the founders, both John Kabat-Zinn and Mark Williams, wrote about their course and wrote a book about it with chapters for session 1, 2, 3, 4. So that enables researchers to do research. So that's one side of it. So it's pretty standard across the world, and that's an advantage. But what we also see is that it needs adaptations for particular populations. So, for instance, for the patients with ADHD, we can't ask them to meditate for 3/4 of an hour during the first session. So we have to gradually build that up. And for patients with cancer, the discussion and the didactic parts of the session are different than for patients with depression. And if people have taken a basic mindfulness course, they might want to go on developing that further and develop compassion, for instance. So we do develop other formats and both graduate courses to follow up from the mindfulness and expand that. But there is a tension, and we might come back to that later, between Western approach of research, which requires standardization, and applying things to or tailoring things to the individual, which requires flexibility.
Thank you very much. That's a nice bridge. So it's a pleasure and honor to introduce our second speaker, Lama Michel Rinpoche, who is from Brazil. He's a Brazilian, born in 1981, and met Lama Ganchen, his teacher, when he was 5. Then went to the south of India, decided to become a monk when he was 12, and had 12 years of traditional training in Serame, in a traditional Tibetan monastery. Then later continued his studies in Tashilhunpo, which is one of the most alive and well-known monasteries in Shigat in Tibet. And meanwhile, traveling around the world, going to different conferences and places to give public talks or scientific talks or in different contexts. And so we like to hear what Lama Michel will tell us about mindfulness and compassion in healthcare. So please give a warm hand to Lama Michel.
Good evening. So, I would like first of all to say that I'm very happy to be here today. And it's really a great honor to be together and to have this exchange, because it's in a way something that shows us, to me, and I think to all of us, that we are together following the same direction, which is what we want is the well-being of everyone, which is the best way how we can get to that. But I would like first of all to do a very short prayer that I do anywhere I go. And I'm not able to do it without doing this prayer, I'm sorry, that's my own limitation. But it's a prayer that I do. It doesn't matter if I go to a school, if I go to a hospital, if I go to a congress, or if I am in a temple, it doesn't matter. Basically, it's a prayer in which I remember my teachers and the teachers of my teachers, because I believe that gratitude is so important, and if there is anything I can share with you, it's because someone has taught me. So I would like just to bring a very short prayer. The first part is in Tibetan, the second part is in Sanskrit. So I will just, okay. Ocho sambo bagyo trashe patu che tembe jule yakmoda peke drolo sambe zebra che pande lame shabla sovade omo guru vajra dara sumati munisha sane karma uta vardani shri vajra varsa manya sarva siddhi Pakyuke kudandagi lo, pakyuke sudandagi ma, pakyuke tudandagi, tenyerme chikto jingi lo, makyuke kudandagi lo, makyuke sudandagi ma, makyuke tudandagi, tenyerme chikto jingi lo. Om muni muni maha muni shakya muni so. So, I would like to start with a question. Because I believe, first of all, that questions are more important than answers. And very often we don't get the right answers simply because we never make the right question. And I'm very happy when I have a question that actually I cannot find the answer. I think that's really something good. But a question is a very basic one, but very often we don't think about it. When do we need to take care of our health? When we are healthy or when we get sick?
We should do it first.
I believe
We should do the first, but
I believe the most important moment when we need to take care of our health is when we are healthy. When we are not healthy anymore, then we need to take care of sickness to try to bring us back to a state of health. So when we talk about health care, we shouldn't be talking only to the sick and thinking it's something that has only to do with those that are sick. I think first of all, those that are sick, they need to take care of disease care. And those that are healthy, we need to take care of health care. Okay? And sometimes there may be some confusion with this. So, how does we apply meditation and compassion to our own health care? When we talk about suffering, which is state of lack of health, basically it's when our body, our mind, is in a certain state that generates suffering to ourselves, that generate a sensation of not well-being. We are in a sensation that we are not comfortable with ourselves, or at the same time there is conflicts, and basically we are not feeling well with the body and the mind. Okay? But now here we go to something that is coming mainly to our modern times, which is, if I ask to all of you, what suffering do you have more, physical suffering or mental suffering? What do you have more? What do you think? Physical or mental?
Mental.
Mental suffering, right? So we have developed in our society quite a good way to deal with physical suffering. This is a sign that we are also some sort of part of the very rich part of society in the world. We are in the rich part of the world. Like one of the masters of my master, he used to say, suffering are of the two types, physical and mental suffering. Poor people suffer mostly from physical suffering. Rich people suffer mostly from mental suffering. By the end of the day, they suffer in the same way. Okay. So, what happens is that as we have very strong patterns of physical, of mental suffering, with anxiety, fear, sadness, anger, and many other states of mind that generate this sensation of not being comfortable with oneself. The question that comes to me is what to do. Because actually, one of the most powerful resources that exists in the world, I believe it's the mind. If we look to conflicts that exist in this world, if we look, for example, to the conflicts that exist within family, a couple, a family, in the work, if we look at the conflicts that exists in society, the conflicts that exists internationally, where are all of them coming from? The mind. From selfishness, from aggression, from unlimited attachment, from insatisfaction, from ignorance, and so on. So basically they're coming mainly from the mind. On the other side, if we look at the great things that happened in the world, and the people that were able to really make a change and help so many others and so on, which was the resource that they used to do all of that? The mind. But there is one point that we need to understand when we say the mind. The mind can be trained. It's not a matter, but the most important thing is not that the mind can be trained. Here it is. So we go back to the attention. Okay. So the main thing, helping for attention over here, ask you just to remind me time, okay? So what happens is that not only the mind can be trained, the important concept is that the mind is constantly being trained, willing or unwillingly. Every image I see, every sound I listen, every thought I have, every place I go, every person I meet, every experience I have is shaping myself and is shaping my mind. We don't have the choice to transform or not to transform. We are constantly transforming ourselves. The question that comes is, do I want to transform myself consciously or unconsciously? Do I want to be a simple byproduct of the informations I receive around? Or do I want to direct my mind in the way how I want to familiarize it and train it? Because there are many things that worry me nowadays. I think that things worry me nowadays because I have no memory of other times, okay? So we worry about what happens now. But when I look to society, one of the things that really I'm a little bit worried, which is connected to what we are talking today, which is the fact that, first of all, when we talk about healthcare, we cannot only remain on the aspect of taking care of the symptoms. We must go to the causes. And I'm very happy with the beautiful work about mindfulness, and it's so important to see how these methods can help us to deal with many of the symptoms. And at the same time, we need to go, even starting from our own lives, and understand which are the causes that will bring such an increase on problems with attention, anxiety, people with panic attacks, and so on and so on. You know? The number of people that are having more and more mental disorders, like starting from anxiety or burnouts or stress and many other forms and panic attacks and so on, from the little that I know, is growing quite a lot. I have seen in Brazil, it's growing a lot. I think in Europe also. Okay? So what does that mean? That we are doing something wrong. In our lifestyle, in our daily way of living, there is something that we do in our life that is creating this stress level and this level of disbalance of the mind, unbalance of the mind. So we need to go to look also to these causes. When I talk about inner science, it's the aspect that in Buddhism, one of the most important aspects is logics, following logical understanding, and following one's own experience. So we analyze our own experience and our own reasoning, and we compare that with others. That's basically how we follow. Okay? And there are some things which for me worries me quite a lot, and I'd like to share with you also, which is connected to that. Because we can go on the part of mindfulness and explain the benefits of meditation and so on, but I'd like to focus a little bit also on the other part, which is the actions that we do, which have an opposite effect. Okay. We live in a world nowadays which more and more we have a very, very high level of sensory distractions. And whenever we take a text, that traditional text from Buddha or later inside Buddhism that explains how to meditate, before explaining, sit down, this is the right position, focus on your breath and this and that and so on, the first thing that it says is, first of all, eliminate the objects of distraction. And nowadays, if we look, there is an addiction for distraction. How many people go to sleep with their phone in their hand? How many people wake up and not even awake yet, go take the phone to check what is happening? Hopefully not many, but that's not the case very often. Okay. And most of the times when we go to look for an information on the phone, on the news, and so on, Facebook, whatever, what is the main reason why most of the time we go to look for information? I'm generalizing, okay? Why do we do most of the time that? Not because we are truly interested about something, but the simple pleasure of having some new information. There are many doctors here that can explain much better than me, but from my very small understanding, whenever we have something new that appears to our mind, it gives a shot of pleasure. And this creates addiction. The amount of stimulation, sensory stimulation that we give to children nowadays, it's so violent. And what is happening is that we are taking away our capacity just to be by ourselves, our capacity just to listen to others, to go deeper into subjects. Because we need to run more and more, more and more, more and more. We try to go faster and faster, and finally we get nowhere. The metaphor that I see is like there is this gymnasiums, no? The place for the gym where people go to do exercises. And there is one in São Paulo that I always pass in front when I go to Brazil, going to my mom's house. And there's this glass wall in front. And you see all these people running to go nowhere. And for me, there's a very clear metaphor of a lot of the things that we do, because it's this attitude of getting more and more information, but not really to know anything. And very often we run, and we don't know really where we are going. So what I want to say is that, yes, we must deal with the symptom, and we are very fortunate because there are many people doing this, as we have seen in research. There are many people that are taking care of that, and that's so beautiful and precious. But at the same time, we must, each one of us, I'm talking not generally speaking the whole society, each one of us, we must look and say, okay, I'm still healthy mentally. I'm not yet in the high level of anxiety. I am not yet with a burnout, but which direction am I going? Am I taking care, truly, of my own mental state or not? And meditation is basically an exercise for the mind. In meditation, one of the things that is very important is that we have an object of meditation, Gombe Migyu, we call it in Tibetan, Gombe Yul, which in some people call the anchor, to which we connect the mind. And that is the ability that we have to focus the mind on that object and simply relax from distractions. When we meditate, it's not a state of tension, that we focus on something and we become blocked on it. Our way, we need to relax from the distractions and let the mind just rest in one object. It can be observing the sensation of the body. It can be observing our own breath. There are many different ways. But one of the concepts of meditation that I would like just to take the advantage to bring here today, because I see that very often is not so much spoken about, is the fact that meditation is a technique in which we self-induce ourselves. We induce ourselves to certain states of consciousness, to certain states of mind, such as patience, love, concentration, wisdom. There are different states in which we can induce ourselves in order for gradually that states of mind to become natural and spontaneous. So there are meditations to develop more patience, there are meditations to develop more love, there are meditations to develop more humility, there are meditations to develop more generosity, satisfaction, and so on. In the same way, there are many techniques that, the same techniques that go in order to help us to overcome and to go beyond the other counterpart, which is anger, jealousy, fear, miserliness, and all of that what we were talking before creates our mental suffering. Okay. So for me, meditation is something that we should apply as a method, not the day that we really need when something is getting really bad. Also because the 8-week course is something very powerful, but as we were talking before, it's not something that is enough in our lifetime to do 8 weeks. It's something that we need to go on. It's like, for example, if I have a certain health problem, okay, I do a certain exercise, or I take a certain medication, but let's talk about change of diet, for example. I change the diet for a certain period, it will help with the symptom I have. But I need to continue to keep a healthy diet as I move along. In the same way, meditation is like doing the exercise for one's own mind. And this is very, very important in order for us to keep a healthy state of mind. And one of the basic aspects that comes together with meditation, before entering in any other type of meditation, is mindfulness itself. It's the ability just to place the mind into one specific object and let the mind rest there, and then instead of going into hundreds of different objects and the mind running up and down, it's our ability to direct our mind, to be present at the present moment. And this is something that I believe is very, very important for all of us. So, one of the things which I try to do myself, and I think that is important for all of us to do, even as a normal person or as a doctor, doctors are also normal persons, not necessarily in the relation doctor-patient, okay, is for us to ask ourselves, what is a healthy mind? How would I want to be? What is a healthy mind? How I want my mind to be in order to have a healthy state of mind? I tell some things which I believe, okay? I think each one of us, we may get a little different result. But basically, for me, healthy mind, it's a mind that reacts positively to different stimulation and difficult moments. It's a mind that relates to the world in a coherent way, that do not expect things to be necessarily different from what they are, that understands the mechanism in which we exist. It's a mind that at the same time is a state of relaxation in which we are comfortable with ourselves and we are comfortable with the environment and the people with whom we are. The ability to be able, a healthy mind is able to connect with others and generate empathy, sympathy, love. A healthy mind does not complain, but put effort in the solution instead of being blocked in the difficulty and the problem. Because one thing is very clear, life is difficult, or not? There's one thought that came to my mind these last days, and I have been saying it on different occasions, but it's the following. You know, when we say life is difficult, is childhood easy? No. I was yesterday in a school, and I asked the kids, they were already in their teenage, and I said, is childhood easy? And they were, no. Okay. Then we go, is the teenage easy? No. Sure not. Okay, then entering into adulthood. Finding a job, choosing a career, building up relationships, taking care of one's own livelihood, and doing all of that, and keeping that up, and all of that. Is that easy? No. Okay, is retirement easy? Not, especially in a society that does not respect much the elder. Is dying easy? Not really, I think. Is being born easy by chance? Also, I don't think that's an easy process also. So, life, since birth, from birth to death, is not an easy thing. And the main thing which comes from this inner research of Buddha is that our goal is not to make life perfect. Our goal is not to create conditions around us in which everything will be just as I expect it to be. Our goal is to develop our own tools in order to relate to the world in a way that is so-called perfect. Is to deal with the different situations of life that come, which is normal and have always been. I've never met anyone that life was completely easy. But I have met many people that used the right tools how to deal with the difficult moments of life in a way they didn't enter into a whole turmoil of suffering and anxiety and so on. That they knew how to use that condition in order to make a good use for themselves. So the point is not to have one time I was talking to a friend and I was saying to my friend, oh, it's not so easy something. And he was saying, but our life is not meant to be easy. It's meant to be meaningful. And the point is that meditation is one of the tools, there are others also, that should help us to be able to have the strength to deal better with the different situations that happen in our lives. We all are going to go through losses, and we have been through many losses. We all are going to go through our health degenerating, or not. We all go through different situations of material things, of conflicts within our relationships and all the rest. That's normal. That's life. So the goal is not to create a life that is perfect, but to change the way how we relate to the situations. And in order to be able to do that, the main resource that we do have is our own mind. And for that, we may be able to take our mind, take the reins of our mind, like a horse, and direct it. That's where mindfulness, that's where meditation comes in. To be able to help us to direct our own mind and don't let it completely loose. So having a metaphor, I see as through meditation, through mindfulness and so on, the objective is to become like a very strong tree with deep roots. That when the wind comes, the tree feels the wind, moves a little bit, but never goes out of its own place. Which means the situations come. We feel the situations, but it doesn't take us out of our own emotional balance. On the other side, what happens very often is we are not even like a tree without big roots. We are like a small leaf on the wind. Wherever the wind blows, we go. So normally if we ask a person, why are you happy? Because this or that happened. Why are you suffering? Because this or that thing happened. So very often we have this idea that our mind, our inner state of mind, is a result of the world that is around us. We have this idea that if my mind is healthy or unhealthy, which means if I am suffering or not suffering, if I am in an inner state of well-being, or if I am with sadness or anxiety and so on, has nothing to do with my mind. It has to do with the conditions around me. But the way how we experience conditions, it depends on our own mind. One very simple way of understanding that is that no one is able to perceive anything independently of oneself. The observer is one of the most important parts in the experience of reality. When I see you, somehow I'm seeing a reflection of myself. Is this concept clear? So what happened here is that if I am sick, if my mind is not well, I will see everything through that eye. And I will deal with situations in that way. If I have a mind that is more stable, that knows how to rejoice, that has a strong basis of compassion, of connecting with others and so on, I will deal with the situation through that mind. Okay? So this is one of the very important things that I wanted to bring. Is the fact that based on what I learned and the experience that I have and following logics and so on, which is what we may call inner science, okay, which in Buddhism it has a very specific way, but now we're not going to go into the whole process of logic, reasoning, and or experiencing through meditation and so on, so we don't need to go through that. But if we go and we analyze ourselves on our own lives, which is I think the first thing that we need to do, how important is our mind? And what are we doing about it? And it's our mind that determines the way how we experience the world, and not the world that determines the way how our mind is. It's clear, this distinction. Okay? Sure, our mind is influenced by the world. I have no doubt of that. But the world, in the way how we live it, it's much more influenced by our mind. And meditation is one of the ways in which we start to direct it. And we learn to have this ability. And this is something that I think we really need to take seriously into consideration. But it's not something that comes easy. It's something that takes effort. It's something that needs constancy. You cannot meditate for 1 week and then do not meditate for 3 months and then expect that you are on the same line that when you were 3 months before. It's not like that. So there is one story which really shows this, which for me is very clear. Just to understand timing, how we are.
I left my clock there.
Huh? Okay.
It's about time.
Okay. So I will just conclude this part with a small story, which is about the importance of constancy. Okay, I had one story in mind, but I will change the story. I was one time in Tibet going to see my teacher, the abbot of Tashilhunta Monastery. Very respected person, and so on. So I went there to see him, and as I went to his room, he lives in the 4th floor in a very old building with very difficult stairs to go up. And then, as I was going there, in front of me there was a young monk carrying like 20 liters of water in his back. Going all that stairs up was quite difficult actually. He was doing it quite easily because he was used to do it, but it was quite a difficult task. And what was that water for? Cleaning, washing, cooking, drinking, because they have no running water on the tap. Very old constructions, at least 800 years constructions. Then I asked my teacher, and as I reached there, I said, oh, Gela, that's the way how I call him, and I said, please, why don't you put a tap? We bring a pipe up, you know, it's quite simple, the technology is here. Running water is there in the city, we could do it so easily with a very pragmatic mind. And the money is there, the monastery has the money to do it, why not? Later I came to learn about one technical reason, but that could be overcome anyhow. But he told me the following, he said, very simple reason. If the young monks do not learn to put effort and constancy in the most basic things of life, such as having water, how will they later put constancy and effort in their meditation? Because it doesn't come easy. There is no free lunch. Everything comes and needs constancy. It needs some effort. Why do I think that it's much more easy finally for people that get sick to meditate than people that are healthy? Because they have an incentive. Fortunately, we have so many research that are showing the benefit of that, so we finally say, okay, that's good, let's do it. Why? Because I'm out of my comfort zone. Because I'm feeling sick. So I will do something to help me. But we need to start doing right now. We need to take care of our health from when we are healthy. So when do we need to meditate? When we get sick or when we are well? When we are well. And most probably, if we meditate correctly and we do it enough, in a nice way, what will happen? We will prevent some sorts of sicknesses also. Okay. So my conclusion from this is, remember that the most powerful tool that we have is our mind, and we must take care of it. And do it based on your own knowledge, your own logical reasoning, but mainly on your own experience. If you do something and you feel it's good for you, then just continue doing it. So try to meditate. If you see that it's good, do a few days, course, 8 weeks, whatever. If you feel that it's beneficial, then move on and do it. Because we need to keep the state of our own health. No one else can do for us. Okay, thank you.
Yes.
I thought you were looking.
I'm trying to do straight.
Yes, right. Thank you very much for your speech. When you were depicting modern society and the information ways we are living in and losing contact and looking for new information, etc., I was wondering if you combine that with the current, let's say, growing interest for mindfulness and meditation, isn't there a positive relationship between the two? In the same way that people start wondering about their health when they're sick, that actually we all are in the position of getting more sick in our mind, and that's why we start wondering, or we start growing towards mindfulness and Buddhism, and we're inviting lamas in Nijmegen, etc. Like two sides of the same coin.
Yes. I believe that there is no such a thing as something that is all by itself good or all by itself bad. There are things, and then it depends how we relate to them and what the things that they bring. They bring good things and they bring bad things. I think that when we go into a situation that starts to manifest its unhealthy state, for example, the lifestyle that we have nowadays, the modern lifestyle that we have, when it starts putting us out of our comfort zone, when we start seeing, then we go to look for solutions. And the fact that it's bringing to our lives more healthy eating, more mindfulness, and so on, I think that's very good. But the point what I think is very important at the same time is that it's not enough just to look for the solution for the symptom. We must take care of the cause. It's like when we talk about cancer. Okay. Sorry if I put in these words, but it's my own point of view. It may be completely wrong, but that's my point of view. Is that we have a lot of research and a lot of money being put into the cure for cancer. And I think that's beautiful, that's important. But I don't think that's really the most important direction. Because cancer is an epidemic that is going on. And we need to deal with the causes. I need to change the lifestyle. We need to make drastic changes in the lifestyle in our society to prevent sicknesses such as cancer from coming. Instead of keeping all the causes there because it's too difficult to change the lifestyle, and then we will just treat cancer by finding new medicines to make it easier to cure. I don't know if it's clear, the comparison. So I think it's a very positive side effect of the unhealthy lifestyle that we have, that we are bringing, opening ourselves to mindfulness. But this doesn't take away the fact that we must look at the causes. This is something which I think is very, very important.
Anyone else?
Yes, about healthcare. Do you have access to governments and politicians? Because they can, for example, in the United Kingdom, we have the Mindful Nation in Parliament, and Speckens has access to health, to politicians, I think. But what is your experience with politicians and this aspect of dealing with not sick people, but really with healthcare? Could you reflect on that?
Yeah, the point is the following. I personally have no experience dealing directly with politicians or with health policies and all this small part. I think it's something very important. The difficulty that I find in many places is that very often the priority on the system that we live is not truly the well-being, but is the economical factor. So we have lobbies, we have things, and it's like one time I remember talking to one doctor. I don't remember him exactly. He was one of the congresses that I came here, one of the doctors there. I'm sorry, my memory for names is quite terrible. But he came here and he was a doctor very much specialized in non-conventional healthcare with traditional medicines and other ways of healthcare. And he was saying that when he talked to most politicians, personally, when they got sick, they would go to the Chinese doctor, they would do other thoughts of alternative ways to take care of their health. But if you ask them, would you vote a bill to make changes in the system? They say no. Why? Oh, because that's too dangerous for my image. That's not something that I don't know how it will be, because I have other lobbies, I have other, let's say we're tighted in other things, you know. So I think that what happens sometimes in politics is that the people, very often they have a good heart, they have a good idea, they have good things, but they end up entitled into many other things. And most of the times it's related to money. So the way I believe and the way I try to do, basically I talk anywhere I am invited. So if someone invites me to talk anywhere in the parliament, I would go. I have no problem to whomever I talk. I don't make distinction if in front of me are school kids or politicians. The point is that I believe that the change means come from both sides. We need to deal with policies. We need to try to bring new things to education and to healthcare and so on. But at the same time, we must start with the people. Dealing with it. For example, one thing that came to my mind as you made this question is one system which I hope one day we will be able to apply. So I just put here as a small seed that I throw. In ancient China, around 3,000 years ago, doctors would be paid when the people were healthy, not when they were sick. So it would work in the following way. There would be a village, a city, and every doctor had a certain number of people that he was responsible for. He was responsible for their health. So as long as the people were healthy, they would pay every month. When they would get sick, they stopped paying. So what would happen at the time? The winter is starting. The doctors will come together and go to the houses and say, change your diet, be careful the way how you dress, do this, don't do that. What would happen nowadays if it was like that? The Union of Doctors will make policies to change laws, not allowing certain types of food, and making changes that this is unhealthy, it cannot go like this, and that cannot go like that, otherwise we do not get paid. So I believe, I'm just throwing a seed in the air, okay, that the best will be for our healthcare to take care of health, and not to take care of sickness, and to take care of sickness is a side part, which needs to be there, but it's mainly taking care of health. And to take care of health, we must first take care of the healthy lifestyle, which brings many other aspects.
I'd like to invite Anna Speckens also, because I hear a small part of your question was also directed at Anna, and then we can make a transition to your dialogue. So if you could put here. So Anna, you are very much influenced, or you very much influenced policy, I hear. Can you elaborate on that?
Not really. Ready to? Yeah, this is all, I think. Well, I agree with my colleague in the sense that we should use both approaches. So we do try to bring mindfulness to Parliament. In the United Kingdom, it's done in a much more structured way than in the Netherlands, as you mentioned. So the Mindful Nation is actually a cross-parliamentary party coalition looking at how mindfulness could be of help in healthcare, in education, in the criminal justice system. So that is really something to aspire to. And in the Netherlands, we're just at the start of that, really. But it would be good to have members of parliament get acquainted with mindfulness and get experience with that and know what it might bring. But it shouldn't let us off the hook in developing it ourselves and applying it in our own environment, as you are doing, I know, yourself.
Thank you. So the two of them are there, so take your opportunities. Anouk.
Yes, I had a question. We saw the definition of mindfulness.
Could you
stand
up?
Stand up. You had a definition of mindfulness from your perspective, and I'd like to know the Buddhist perspective of mindfulness, what you understand, whether there may be a difference or not.
Okay.
answer.
I think there is no such a thing as a real answer. The first thing, it's a bit difficult to give a precise answer. The first thing that mindfulness in the traditional Tibetan Buddhist way of meditation is one part of meditation. Okay, so normally when we study how to meditate and the techniques of meditation, there is meditation, there are mainly two different types of what we call enemies for meditation, which is we call Qingwen Gepa, which is a mental dullness when our mind, we're trying to meditate, but actually our mind becomes a bit foggy. And then
Fall
there's,
asleep sometimes.
that's when it gets really worse. And then we go to the other problem, which is mental agitation, that our mind is running around. So one thing that happens very often is that when we start learning how to meditate, we're able to stop the mental wandering, but then we fall into mental dullness. And that's not real meditation. Because what are we familiarizing ourselves with? Mental dullness, not with a specific object of meditation. The danger of that is that mental dullness is pleasurable. Okay? That's the danger that comes. So normally mindfulness comes as one of the two antidotes that applies together with the meditation to eliminate these two effects, which we normally call memory, recollection, and mindfulness. The translation, I'm never satisfied with them actually. But basically, one is the aspect within the meditation to keep the mind focused on the object, and the other is a part of the mind that is aware of what is happening, is to remain aware of what is going on. So this is normally what it will be called the part of mindfulness. I am aware of what I am thinking. I am aware of where I am, to be aware of what we do, to be aware of what we think. So in this way, it fits perfectly with the definition that was given before. I think there is not much difference. But this is one part of meditation. There is much more actually to get with that.
Can you like to respond?
No, I agree, and I also think that the much more is something that we need to develop. It might have to do with wisdom, with compassion, with insight, with an ethical way of being in the world. And those are aspects that need consideration and practice as well within our Western society, in addition to these basic qualities that we have discussed now.
Sure. Yeah. One important thing is that these are not things, even to meditate well, it's not something that even if we look in the monasteries, everybody do. It's not as easy as going to a gymnasium and running on that.
Which is not easy in itself.
Also for me it's not easy at all. It's not easy as that still needs a lot of effort. But what happens is that meditation, it takes other aspects and it takes a change of lifestyle to be able to meditate well.
Yeah.
This is something that comes together with it also. But this is a very, very important beginning that we are doing in our culture, I think, to bring this. We were talking before between us, saying that Buddhism, for example, took centuries sometimes to establish in a specific culture. And now we're at a moment where we are receiving a lot of input from Buddhism, for instance, into our Western world. Which way it will take, or how many ways it will take, we will only know after maybe 50 years. That's what I think. So I think this is very important where we are right now. I think it's something very beneficial.
Well, the question that came to mind is there any form of doing outer research in Buddhist tradition, like Anna is doing here in the West?
Please repeat the question for people.
If there is any way in Buddhism to do outer research, I think the only way would be the same way. I think there is no any other way. And I think we could do, but that's not what normally monks are trained to do. I think there is a lot to learn from that. And I think it would be very good to do it also. I think it's something that I would love to learn and I would love to do myself in this way. But it's something that, let's say, the most Eastern tradition needs to learn a lot from the Western tradition. This is something which I believe is very important. Because Buddhism originally, I think it was never started as a religion. It's like one time someone came to Buddha and asked about God. And Buddha answered, I'm not here to talk if God exists or if God doesn't exist. I'm here to explain how you can, he said, I'm here not to talk about existence or the non-existence of God. What I'm here to say is that your happiness and your suffering depends on you and no one else. So how can you be happy? How can you be free from your own suffering? So I believe Buddhism originally, Lama Michel says that if Buddha would come now, Buddhism would not be a religion most probably. So I think as Buddhists we have a lot to learn from the Western scientific approach, which I respect a lot, and I think it's also very important. So let's hope one day we also do outdoor research in this way.
There are actually collaborative efforts or collaborations between Western scientists and Eastern monks and philosophers. So in the Mind and Life organization, for instance, that is one way of that is supporting that collaboration.
More questions? Criticism is also invited.
Which role does education play for you in developing mindfulness?
First of all, which role does education have in developing mindfulness? First of all, I think that all aspects of life need to be taken into consideration together. And they're all very important. The environment in which we live, the way how we eat, the education we receive, how we take care of our health, all of this is together. My dream, in a way, is that every child will learn to meditate since kindergarten.
5 years old,
Start when you're small. I think this would be something that would make a big difference in our society. Because it's not something so difficult. It's not something religious. But it would make a big difference because when we learn something since we are small, it becomes part of us much more easily. So in this sense, education has a very important impact, but not only education on meditation, education on health as a whole, mental and physical health. Which, I'm sorry to say, but my own perspective is that it's not so much taken into consideration. In the whole educational system, it's not taken so much into consideration. We go to schools where we teach about many things, that when you go to see the food that is given to the kids, it's unhealthy. So this is one example. How can I teach them how to eat healthy if I give them unhealthy food? So this is just one example. So I think it is something that, yes, it is very, very important. And again, but we can only teach mindfulness in the schools when those that are responsible for teaching the kids, which means starting with the parents and the teachers and those that nowadays are the adults that have the power to make changes, understand the importance of mindfulness themselves. That's when actually we're going to be able gradually to apply it also to an understanding.
And there are quite some efforts already of introducing mindfulness to schools, both primary schools and secondary schools, which you yourself are part of. And again, I as a scientist think that we should accompany that with proper research to also convince other people that might be more skeptical about it of the benefits of it and help introduce that in a broader sense than just the schools and the teachers that are already interested in it.
Can I add something about that? One thing which I think is important is that our educational system is directed for the market of work, right? So basically the subjects that we teach and everything is for what? In order to fulfill the needs of the work. If we go to most companies and we ask them, what is the greatest difficulties that you have with your employees? The lack of knowledge, the lack of techniques, or the lack of emotional stability? What will come out? A lack of emotional stability. Because techniques we can teach, we send them to a course, we give them whatever. So why in the whole educational system they are not being taught on the techniques which exist, mindfulness is one of them, to develop more emotional stability? As this is one of the most important things that we need in life and also in work.
would like to raise a subject which I hear many times people have ideas or questions about, which is religion and mindfulness. So we are in a country where we have like omzuiling, a secular society, where we have stopped many people have stopped going to churches and looking for new ways of meaning. Then mindfulness and many other practices came from the East to, for instance, Holland, other countries. And some people have embraced it, some people do not embrace it, some people feel you cannot just take something out of one culture and put it here and it will be different than it was in the other culture, or it can be, maybe you can take away the cultural roots, or you can take away the religion part and make it like a secular practice. Can it be done, can it not be done? People have different opinions about this, so I'd like to hear what both of you think about it.
Would I like to start with that? From the Buddhist tradition, the Buddha invites us to examine and to investigate, to use our own minds to find out what's helpful and what isn't. And that should actually be the basis, and that is also the basis of the mindfulness course that we are offering or teaching other people. And that might help us to find the way and the format to bring this in our time to our society. You're right to say that our society is secularized, and sort of people don't go to churches anymore, don't consider themselves to be religious. But at the same time, we do have many convictions and beliefs, and we are attached to a lot of parties or professions or social class or whatever that we feel we belong to, and those might be as restrictive actually as the olden day religious sort of classes we belong to. So I think the challenge would be to be open and curious and to investigate together what might be the best way to take this forward to our own benefit and to the benefit of others and the world at large.
Okay, I will say something that may look a bit strange, okay? But personally, I don't think I am a religious person. In the sense that I do not believe in religion by itself for itself. I believe that religion is something that is a tool, it's a method. I think I talked about Buddhism, the one I'm part of, but I believe all of them. A tool to help us to develop our own qualities, to develop our strength, to deal better with the situations in life, and what we call, if we use our words, to follow our own inner path or spiritual path, which I think is a need of human beings. So, when, as you said very clearly about Buddha calling us to look at things, to inquire at things, no, as I said, yes, we don't follow what I say and don't believe in what I say just because I said. Do the same that you would do with gold before buying it in the market. When we go to the market and we need to buy gold, that's not what we do nowadays. 2,500 years ago, that was more common. But we never buy the gold simply because someone tells us it's gold. You need to cut it, you need to scratch it, you need to burn it, then you will check if it's real gold or not. But once we check and it's real gold, then we need to buy it. So what happens is that I think it's very important from us to check from all different traditions and to find out what is there that is truly beneficial for us, what is there that we really need, and by that to apply it on our own lives. I don't think necessarily we need to follow the original structure of religion. I think this is not something that is necessarily, even because if we look inside Buddhism, the structure of the religious belief and the way of practicing Buddhism in the very inside the religion is changing, has been changing from century to century, from context to context. It has been changing a lot. Things do not remain always in the same way because they are supposed to adapt to the needs and the capacities and the contexts in which they are. So I think that with mindfulness doesn't necessarily need to be within Buddhism. I believe that anything that is from Buddhism, if taken out from Buddhism and practiced in a context in which we say, okay, we don't want to be Buddhist, but we just want to take that, wonderful. I think that's wonderful from any aspect, from the philosophy to the practices and anything else. But what I'm a little bit careful is that I think that sometimes we have the tendency just to take a small part out and forget that that is a part on a whole process. And this is something that we always need to remember. It's not like we just take one small part of a complete system and then we think, okay, that part is wonderful for me, and we forget that there are other parts which also complete that system. So when we look inside Buddhism, the difficulty that I find is that very often we use terms and we bring in a way that there is some blockage, there is some preconcept because it looks almost religious. But when we really look to the aspect of what is a Buddha, for instance, it's actually what? A human being developing one's own qualities at their maximum potential. That's what we want to become. And the Buddha is showing what we can do, it's believing in one's own potential. And I think these are all important things independently if we're Buddhist or not. That goes together with the whole process. So I think that yes, it can be separated. I agree fully, we need constantly to analyze, we need constantly to check. But also there have been people checking for centuries and they have got a lot of experience on things. And sometimes we get blocked simply because we use different terms and different ways of doing things. But that's why I think we just need to keep an open mind. And what I believe is that the day that we die, there is no distinction between you were religious, you were not religious. Okay, Christians this way, Buddhists that way. You are non-believers, you have no way to go. I don't believe there is something like that. I believe that what happens is that how much love have we developed? How coherent have we been in our life? That's the important things that comes along, both life and after death. So in this way, I'm not attached to Buddhism itself. I believe that it's a very, for me, it's a path which I follow, and I'm very grateful to, but I don't think that that's necessarily the best solution. I don't think the world should be, everybody should be Buddhist. I don't think that's the best way. But I think inside Buddhism, there are many tools that will be very good for everyone to use.
Thank you very much.